Hey guys, and welcome to today's live stream. We're going to be talking all about that sort of lower middle back pain around about the TL. We're going to talk about posture, its influence on these things. We're going to talk a little bit about radiology findings. What do we see on the imaging that we use in the clinic and have used over the years that kind of help you guys understand why this pain can sometimes be here, and also how does it then relate to those lower lumbar injuries, those L4-5, L5-S1 disc injuries where we've got problems at the bottom part of our spine, maybe giving us things like sciatica, etc. So hopefully it's going to be a really good one for you guys today. And as always, we've got Lara, the other side of the camera. She's going to be taking your questions down for the Q&A at the end. So if you've got any questions on this or other things related to back pain or neck pain, then post those in the comments below and we will get to those towards the end of the live stream. If you're new to the channel, please do consider subscribing. We do these live streams every single weekday, and if you hit the notification bell, you can join us on the next one and maybe ask a question, get some help for your back pain. With that being said, let's get into today's topic. Okay guys, so we've got a few drawings on the board here which are going to sort of help you guys understand this. And the reason we wanted to cover this topic is all too often people will get a degree of a lower back pain, sort of maybe that's their main issue, sciatica, those sorts of things, but then sometimes it can affect a little bit higher up as well, maybe during the recovery process, and sometimes it concerns people. Other times it's concerned that the kidneys, for example, over this top section here, and people say, oh, I've got a problem with my kidneys, and you know, we'll talk a little bit about that as we go through today's live stream. But starting off at the start with our posture, this is a really important part of the sort of the pain at this region of the spine. It's something that's often overlooked, and it's something that really, it's that bad posture that starts to create issues at this area. It's that bad posture that over time starts to adjust the way in which we hold ourselves, and that can lead to extra strain on other areas, which when they go from an injury of some sort, that can then be a big challenge to overcome and be one of the reasons why recovering from a lower back pain injury can be so difficult. And it's important to note before we get into this that you will see a lot of information about posture, and posture doesn't cause back pain and all this sort of thing, but it's not that if you stand in a bad posture for one time you're going to automatically injure your back. But posture dictates the amount of mechanical stress and strain that is going through our body on a day in, day out basis. And if we have a mechanical structure that has failed in some way, shape or form and has failed to deal with that pressure, by improving the posture and the way in which those muscles work, it decreases the mechanical loading on those structures. And that is where we talk about the relevance of posture. Not that standing bad one time, at an event or at the desk is going to cause you an injury, but it can really be a problem that needs overcoming when we do have an injury and make the world of difference. As many of you will know, changing that posture changes the stress and strain on our lumbar spine, which is why it's really such an important part of getting better from back pain properly rather than doing little quick fixes. So that's really important. Now, there are different kind of postures that really affect our spine, and the big one is going to be that sway back posture, and that is where we have a flexion group through here, which means that basically we're rounding that section. And in my experience over the years, you find that generally there's a few groups of people that are going to suffer here. It's going to be the pregnant and post-pregnant ladies. Now think about that if you're a lady that's been pregnant at one point, you've got a growing tummy essentially, and that needs to be counterbalanced. So we sway back a little bit to counter that load. And what do we then do? We round our back to get our head back over our shoulders again. Otherwise we'd just fall backwards, or we'd be in a V shape, which wouldn't be particularly helpful for guys that are lifting and things. Think about just carrying a heavy box in front of you. You lean back to counterbalance the weight. And what happens there is, this is a rather simple drawing from the side of this section of the spine here, is that we go from having a nice smooth curve that can absorb shock to tilting a posterior pelvic tuck. And then that causes this the upper part of the lumbar spine to start to bend forwards, which is necessary maybe for a short period of time. But when these things start to add up over time, they become the status quo. And especially for ladies that have a little bit more flexibility during that pregnancy period, we can end up getting stuck like this afterwards. And it's something that we really want to be mindful of. It's difficult. You've got 101 things to juggle, but thinking about this thing can mean that the pregnancy experience and post-pregnancy recovery from your point of view can be an awful lot better. So really important one for ladies out there. We also find that the more slight framed people will also tend to have this sort of posture, and if you go down to some of those high-end fashion stores, etc., it's something that really shocks me quite a lot from the neck point of view as well. But all of those models, all of those mannequins are stood there with their hips jutted forwards and a big sway back, and then their heads looking down like that, obviously no face or whatever, and then they're dressed accordingly. But the postures that those very slender flat frame people are being fed through the mannequins, etc., they tend to adopt those in real life, and you find that sway back posture again through here really starts to load that thoracic, that thoracolumbar junction, which is essentially the lower part of our rib cage, below the bra strap we're talking about here, and just the upper part of our lumbar spine. It's not mechanically efficient, and it's really, really important from a point of view of lower back pain, because many of us and many of the people that are doing the Back in Shape program, etc., with back pain have often injured this lower lumbar section. It's the 4-5, it's the 5S1 down here for repetitive loading, etc. And the reason that this is so relevant is holding this section of the spine in a bad position really impairs its function. It's not in an effective position to function as it normally should. And the key with here is this junction here, the thoracolumbar junction, carries out very similar movements to the lumbosacral junction. And if one of these isn't working quite as well, it puts extra strain on the other. And if one of these is injured, the other area is going to have to compensate a little bit more through those ranges. So we commonly find in the clinic that someone may come in with a L5S1 disc bulge, but you find that the structure around this section here is tremendously sensitive and sensitized and tender when we start doing any work in that region. And that's because it's trying to overcompensate, or maybe it's been stiff first, which is why the L5S1 disc has been overstrained repetitively and hasn't been able to manage, because it's doing the work of two sections of the spine. So very, very important. And the third group of people that we find suffering with this particular one is those office workers that are leaning over. When we tend to lean over, we tend to pivot at this section of the spine here. We tend to round our lumbar spine, and then really it rounds forwards at the lower thoracic spine, and that shifts a large amount of weight and pressure onto those discs, but also it stretches the muscles out. And if you've been with any of our live streams before where we talk about muscles, when muscles are in an elongated position like so, they are very, very weak. Any of you guys that have been to the gym, or ladies have done bicep curls, if you do a half rep where you're from here to here, you're very strong. But if you sit on a preacher with this on an incline bench with this bicep stretched right out, we can do much, much less weight. So when we round through this section of the thoracic spine here, and we bend forwards with bad posture, sway back posture, or the other postures that I've mentioned here, we decrease the strength and the stability in those muscles and their ability to exert controlled force on that segment to support our posture and support the whole head and shoulder and rib cage and whatever we're carrying effectively. And that's quite often why, at the same time as maybe having a lower back issue, we get a build up in discomfort, in pain, in aching at this region here. And all too often the gut instinct is to stretch it further when that couldn't be more wrong and more inappropriate. These muscles, as a general rule, from here all the way up, tend, in the way in which we function on a daily basis in society nowadays, tend to be more than stretched. They're overstretched. They're way too stretched. So anyone talking primarily about stretching those muscles further really is missing the fundamental understanding of what's actually going on through most people's body on a daily basis. And actually the process of providing more strength and stability to this region is what is really helpful in holding that effortless posture so that everything else can be in a better position to function effectively, which is so important if we're trying to resolve a lower back pain, let alone actual discomfort at that region up there. Now, what do we see on the radiographic findings? When we get patients coming in with MRIs or X-rays, when they're stood up, we can see much more information. We can see this forward bending, etc. But when we have the MRI and the person's led down flat, we can see that, oh, they've got whatever's going on at the lower part of their lumbar spine. But you start to see these segments here in the bones and the vertebra sometimes, especially if it's been there for a longer time. From the side, instead of being nice and square, they start to become wedged. And one of the findings that you get on the MRI or on the X-ray will be there's some wedging of the upper lumbar spine or some wedging of the TL junction or T12 and L1. And that's because this bad posture has been like that for such a long period of time that the bones actually start to go from a square to a bit of a trapezoid structure. And that, it's not a pain in of itself, but it really gives us a clue. It gives us insight into how long this person has had excess mechanical stress and strain going through this section here, because all too often it may well be a one-off minor event that has actually caused the pain in the back, but it's been the consistent barrage of excess load and excess wear and excess challenges on these structures that causes the final sort of straw that broke the camel's back. And therefore the perception, we need to understand the amount of time this has been attacking this part of our lumbar spine to understand how long it's going to take to actually start to rehabilitate some of these processes, because it can take time if we've had a constant barrage of bad practices and excess strain, so much so that it causes the bones to actually change shape. That's very, very important to consider, especially if we have any of those findings on any MRIs or x-rays that we've had. But we do frequently see that. We see some okay-ish discs in the mid-lumbar spine. We see that there's an injury down here in the lower lumbar spine, and then we see that up here there's some wedging of the vertebra or some excessive degeneration or dehydration of those discs, and that plays into this narrative up here of that sway back posture, of that rounding of the thoracic spine, of that slumping posture, which is really not very helpful. And I've already touched on how this influences the lower lumbar injury. If we've now strained our disc down the bottom here and we've got a sort of a low grade bit of tension up here, which people tend to dismiss as normal. Well, everyone gets this, but most people tend to have bad posture and not look after themselves effectively. So it's kind of a misnomer there. But when we do eventually have a lower lumbar injury, all of a sudden it's very difficult for our body to start to recover, because this guy up here is supposed to be sharing the load with down here. And now it can't do that effectively. It's injured, it's overwhelmed, and it becomes what we call a barrier to recovery. The same way if we've got those stiff hamstrings, or if we've got those dropped arches, or if we've got no core, all of these different little things are barriers to recovery. And when we've got lots of these barriers to recovery all affecting the same segment, it starts to become a little bit overwhelming. And that is where you get the person that doesn't necessarily have that much of a severe injury objectively in the lumbar spine. Maybe there's some minor this and that, but your GP or your whoever says, oh well, it's very minor, it's not that bad, but you'll go there going, well, it is that bad, it's really difficult, it's painful, etc. But they're not able to consider all of the different small factors that individually aren't necessarily significant on their own, but they're all tend to be converging at the same part of that lumbar spine that's injured down here. And that's why it's so difficult to recover. If we don't address all of those factors, then we really struggle to get on top of these things. Now, why is this relevant to you if you're doing the back and shape work? What do we do about this? That's really, really important. Most of you guys watching this video tend to have a degree of lower back pain, and that's kind of why we've covered this area up here. But when we're going through that recovery process, many of you will know the phase 1 work that we do using the towels, etc., to restore a bit of normal alignment to this part of our spine, to help things function a bit better and to learn to engage our core and keep our hips nice and mobile. But as we move into phase 3 in particular, we start to work on some of these postural muscles up here in this section of our body to start to support that good posture. And that is an integral part of the long-term rehabilitation process. To learn to stand more effectively in that, built up over a period of time, will start to take pressure off this lower thoracic region, the T12 L1 region, so that we can effectively have a much less lower levels of discomfort in that region and be much more protected from our lower back. So it's about feeding, maybe focusing on that lower lumbar spine with our core to start with, but then feeding in, working on the muscles all the way up the spine so we can support the back properly, rather than sometimes people get a bit caught up in their rehab and they're just doing, exercises for the lower lumbar spine till kingdom come, and they don't ever branch out enough and start incorporating leg work and incorporating middle and upper back work, because it is a long chain that really has to support this structure. So that's pretty much it for me. If you've got any questions, we'll move on to the Q&A section.
Okay, brilliant. Good morning, everybody. Yes, please do pop your questions in the comments below. I think you already touched on it. You're talking about strengthening rather than sort of flexibility.
Yep.
People who often suffer from this sort of TL pain, they often describe it as a tightness, or maybe they feel jammed in that area or locked up.
Yep.
So you definitely wouldn't prescribe flexibility, maybe something like yoga, to just make them feel a little bit more free in that area?
I think the problem is that those sorts of people tend to be people that don't have a lot of muscle mass. They don't have a lot of bulk. So if a bodybuilder, it's all about the patient as well. So if you're watching this and this is really relevant to you in terms of what you feel, pay attention to the answer. If you're a bodybuilder, if you're coming in and you've got, above average muscle mass objectively, and we've got a lot of stiffness and rigidity in there, and we're lifting, hundreds of kilos, and we're doing all that sort of stuff, we're competing on stage, then I might say, do you know what, actually this person needs a little bit more flexibility work. But the overwhelming majority of the population has woefully inadequate muscle mass and has poor control, coupled with poor posture. That individual who is the sort of the bodybuilder is going to, generally speaking, if they're a proper bodybuilder, not just someone that goes to the gym, they're going to make sure they've got good posture because they're judged on those sorts of things. But the average person, and some people that go to the gym, don't work on that section of the back effectively. Mm-hmm. So we're getting a patient that's coming in who's got a weak, a vulnerable section that's in a bad position and is jamming up because the muscles go, do you know what, I can't deal with this anymore, hold on. And mobilizing that segment further at that point is not, I don't think, the most appropriate method. A lot of these people find the manipulation of that segment really, really relieving. The lower thoracic manipulations crack the joint, it feels better, it goes away instantly. But then we've created more instability in that section. Not that there's pathological instability, but there's more flexibility than there was prior to the manipulation. And therefore, the muscles all of a sudden are going, oh my God, we've got to work hard again. I'm exhausted. I can't deal with this. The person goes back into that slouching position, and then it tightens up, and then the next day they need another manipulation. Yeah. So it's a very short-sighted way of doing things. The unfortunate answer is we have to build muscle mass, and building muscle mass takes a good couple of weeks, and to actually see some measurable improvements. We need to be doing it consistently for a period of weeks. It's not one of those things that gives us a quick fix, which is why we're so inclined to go down the route of getting a quick manipulation or doing a quick mobilization exercise. Things like moving the towel up a little bit and doing a towel stretch through there for a few moments is something I've recommended to patients in the clinic in the past when they have this sway back posture and it's a little bit more degenerative, because it can help them open it up in the long term. But they're always doing those strengthening exercises in conjunction with that. Because if we, and many of you guys will know if you're watching this in real time, that we're working on the flexibility protocol right now for later this month. If we do not build strength with the flexibility, then we're going to end up creating more instability, and that is not good. It's not good for the prospects of recovery, and it increases the likelihood of injury. Okay,
I've got a couple of questions coming through. Joe's just said here, can mid-back pain also come from the neck? It's a good question.
So when we refer to mid-back pain, we tend to kind of, arbitrarily separate it out from below or above the bra strap. So generally speaking, if it's above the bra strap between the shoulder blades, then yes, certainly that could come from the neck, and all too often it may well be a double whammy. We've got very bad protracted shoulders. The shoulders come round like so. We have weakness in the rhomboid region, which is the middle back muscles, the muscles that go between the shoulder blades. And then we also have a bad neck curve because we're like that all day in that sort of position. And that's irritating some of the nerves in the mid part of the neck, which then control the rhomboids as well. And we have kind of a double whammy. We've got actual muscle instability and weakness, and overstrain, and we have nerves that are being irritated in the neck that are supposed to be controlling those segments. Similar sort of process, if you will, to what we see in the lower back with things like sciatica.
Okay.
So yes, it can come from the neck.
Okay, brilliant. And Ollie's asked here, when doing the strengthening exercises, I find it better to lift a little bit lighter than heavier. Is this because the weaker, smaller muscles are able to be worked more instead of the big muscles taking over?
That's a really, really good point there, Ollie. All too often people will go and sacrifice or substitute extra weight for technique. And they use extra weight to actually feel it, and it tends to be a guy thing that tends to happen, and they do less reps. But they'll say, "Oh, I'm going to use the strongest one I've got because I can't feel it when I do it otherwise." If you cannot feel, if we just suppose we do the middle back engagement and we're doing the opening out of the chest and engaging shoulder blades, if you cannot get some degree of cramping after doing it with no weight, you have no business using the strongest weight you can find. We should be focusing on getting the same degree of cramping muscle engagement, especially in the early days, with a light weight. because we're using the control, we're actually recruiting all of those muscles. As soon as we start using heavy weights, we start to get other muscles involved. We get a bit of a swing involved, and then we're using other muscles. We may even be using our calves to do a middle back exercise. So I really would implore anyone that's going through the Back in Shape process, we always say this anyway, that first lot of phase 3, you shouldn't be using anything stronger than the yellow band really for a little while, until you're up to that 5x15, and then we can start, a couple of weeks I would expect, then we can start looking at slightly stronger exercises, stronger bands. But just jumping up straight away to the black ones because you couldn't feel it with the yellow one, that's the yellow's the weakest and the black is the strongest, is a very, very good way of just tricking yourself into thinking you're better than you actually are. So please do not make that mistake. Go through the process. If you cannot feel it on the light weight, you need to do it until you can feel it on the light weight. And that doesn't mean doing endless reps. That means starting to connect this with this, because all too often it's a lack of control, a lack of conscious control that really affects people. And people see this to the extreme. And there's a few members that actually have a degree of nerve damage and they can't control certain muscles, so they can't feel certain muscles working. Well, for many people have that disconnect on a sort of a very subacute level, a very low level, because they just don't have the conscious engagement of those muscles. And we need to spend a bit of time building up that control. Otherwise, we're gonna get a bit of trouble. So please don't make that mistake.
Okay, brilliant. Just jumping over to YouTube, Alex said, great point, Ollie. He's also driving north, but stopped to tune in this morning. So that's awesome. Thank you so much, Alex.
Awesome.
Right, Margaret has asked here, is the Y exercise in stage 2 building strength in this area? Can you do this at random times during the day to build more flexibility?
So you're not going to be building well, you would to a certain degree be building flexibility, because that's very similar to one of the chest stretches that we've got in the premium membership. But also there's the other variation that's a little bit lower that you can do as well, or instead of. What I would say, and that's a very good question there, because it highlights a willingness to get better, which is definitely a good thing without a shadow of a doubt. But sometimes people get caught out and they will do the phase 2 exercises more frequently. We have to remember we've got 2 different or 3 different types of exercises in 2 real categories. We have basic learning and relief based exercises. So that might be your core engagement in the phase 1, the basic part of the Back in Shape. We can do that as many times a day as we can until we get the technique right. And we could do that while you're waiting for the tea to boil, while you're waiting for the bus to come, or while you're sat watching TV. Whichever, you can do that as much as you want. Then, or we've got the towel exercise, which we can do frequently during the day. You don't have to just do it 3 times. You could do it 4 or 5 times if you've had a particularly strenuous day. But when it comes to the phase 2 strengthening exercises and the phase 3 strengthening exercises, where we're trying to objectively improve the strength, it's much, much better to get more bang for your buck in that one session, that one time during the day where you work, because we're looking there to slowly overload the muscles in a confined time period so that they then have time to recover. And we must allow time to recover, because actually, although the stimulation for the change occurs inside your phase 2 or phase 3 routine, the change itself is happening outside. So if we're overtraining and we're not giving ourselves the necessary rest and time for those muscles to recover before we challenge them again with one of these strengthening exercises, then we are going to find that we're overdoing it and we're not allowing recovery, effective recovery. So please, that's why we say with the phase 2 and the phase 3 exercises, they are strengthening. If you feel you can do it, if you feel that you're managing okay with those exercises to the point where you would feel comfortable doing another set during the day, later during the day, then go back and say, how many sets are we doing at the time? We're doing 3x10. Well, if we are, then go up to 4x10. And maybe you need to go slowly up to 5x10. Or maybe you're on 5x15 already. That's 5 sets of 15 and you feel like you could do more. Then we need to go up to phase 3. We need to start incorporating phase 3. That's how we progress through the program, not by just doing more of the same exercises during the day. So it's just a bit of education around how we should progress through the program. All too often people do that and make that mistake. And it's important to know that some people will progress through phase 2 relatively quickly. Some people will take a couple of months, because you have to overcome some technique and some long-standing poor control issues, or that maybe you're a lady that's had a C-section and engaging that core is just so challenging, and we have to take into account that the muscle has been cut completely. Unlike any, men won't tend to suffer with that unless they've had abdominal surgeries. So it's a unique challenge to certain groups of people, which means it takes a little bit longer to go through phase 2. But others, they will go through phase 2 at a blistering pace with absolutely no trouble. And phase 3 is where they need to really sit and work for a longer period. So it's a very unique journey through the process in terms of the speed at which we necessarily go through it.
Brilliant. She said, thanks, this makes so much sense, so helpful, which is brilliant. Right, back over to Facebook. Karen has asked, is acupuncture helpful for back pain? It's very different to what we do.
Yeah, I'd say, I'd ask the question back. I'd say, is acupuncture helpful for your back pain? And that's really the answer there. I personally am not a fan of needles at all. So I haven't had acupuncture done. I hate needles. I'd probably pass out as I do when I get my annual sort of blood test done. So I'm not a big fan of needles, and that's not because they don't work or whatever it is, but those acupuncture points are working to relax and aid certain muscles in terms of their relaxation, avoiding any trigger points, etc., that sort of stuff. Obviously, your acupuncture therapist should be able to go through a bit more detail what it is doing when they do that. So check with them. But if you find it helps you deal with the post-workout soreness or helps you deal with the muscle tension that's going to develop as we're going through the process, then it can be a helpful tool, the same way vibration can be a helpful tool. The one thing I would say is vibration, for example, and acupuncture and massage is doing nothing for the underlying alignment. It's not changing the alignment in any way, shape or form. So it's just understanding what is being done. And if you find that helpful, then do that. I always say, a little bit tongue in cheek, if tickling you with a feather helps make you feel better, then do that. If you find that it relaxes you, if you tickle your leg with a feather, then do that. It's a little bit tongue in cheek, but you get the point. As long as it's not doing any damage, then that's fine.
I think there is such thing as laughing therapy, actually. So
yeah, laughing reduces endorphins. That's going to suppress pain. So
Okay, awesome. I just want to touch on a point that you made earlier during the presentation. You said that frequently people don't really get injuries between sort of L1 to L4. Mm-hmm. The most vulnerable sections are sort of the T12, which we're talking about today, and the L5S1. Is that because they are the junction points, i.e. you've got the L5S1 with its relationship with the sacrum, and then at the top T12 with its relationship with the rib cage?
Yep. So that's a really good point. Wherever we have regions of high mobility translating into regions of very low mobility, there is the potential for trouble. We get issues at the base of the skull, where we've got our C1 vertebra, which is incredibly mobile with the skull, and then going into C2. We get particularly at the CT junction. Our neck is very mobile and our rib cage is not. So the cervicothoracic junction gets a lot of trouble. Has to deal with a lot of stress. The thoracolumbar junction has the rib cage attached to it to the lumbar spine. They both have good ranges of motion in different ranges. So and that's to do with the way in which the facets are orientated as well. And then we've got the sacrum, which obviously doesn't move a lot at all, with the hips attached to it, with the lumbar spine. And L5 doesn't move that much relative to L4. So we have areas where we get rapid changes or big differences in the amount of available range of motion, those tend to be the points at which failure tends to occur. We have a tremendous amount. You might have noticed, because I actually drew this out twice down the bottom here, because it wasn't necessarily as graphically depicting what actually happens down here. But the L5, generally speaking, there are some anomalies here which we won't get into. The L5 is seated quite deep inside the pelvic ring. This is part of the reasons that we say that weightlifting belts are completely pointless and should be avoided, because they make things worse, arguably. But this is very deeply seated. We have a lot of ligament support for the L5 segment. There's lots of ligaments that run from here onto here, etc. The L4, on the other hand, is outside, or can start to move outside of that pelvic support network, if you will, and doesn't have the same sort of protection. So we've got a little bit of a transition here. We've got the sacrum, which doesn't move really at all, and then we've got the L5, which moves a little bit more, and then we've got the L4, which is kind of out in the open with the rest of those segments. And that, I think, is why we see a lot of strain at these particular segments, plus they're the last load-bearing structures in our spine of disc structure. And then obviously we've got the T12, which is having to deal with very powerful prime movers down here, having to dampen that into the rib cage, which doesn't move much at all, relatively speaking. So yes, wherever we have junctional areas, we tend to have a slightly greater challenge at dealing with dampening those forces as they move into the next segment.
Okay, brilliant. Elaine's just commented here. She said, "Hi, so weird. I've been suffering this week with mid-back pain." Good timing from us, so yeah. Hopefully this is helping you, Elaine. Yeah,
I think the main thing with the mid back stuff is invariably it can be really, really achy and really just get on your nerves, and you just want sometimes you just want to get it clicked or something like that. But you can't fix this without a slightly longer term approach. We have to take a good couple of weeks to work consistently at these exercises to create more support and better habits. And a couple of stints in front of the computer is going to, all of a sudden we're back like this. So we really need to be a bit more, it's one of the difficult ones.
And you can use ice always, can't you?
Yeah, we can always use ice. There's a little bit of inflammation around here. We can get a bit of ice on there, and that's going to be perfect for that.
Okay, all right, brilliant. I think that is everything for today. Really hope that was helpful for everybody.
Lovely, awesome. Well, thanks for joining us, guys. Hopefully you found this video helpful and give you a bit of a different insight into other areas of the spine. Again, if you are new to the channel and you're still watching, then please do consider subscribing. We do these live streams every single weekday, and if you've missed the Q&A and you're watching this after the fact, then make sure you hit that notification bell so you know when we next go live, and you can hop on and get your questions answered as well. So everyone, hope you have a great afternoon. It's going to be a lovely day here in the UK, so enjoy, get some sunshine, get some vitamin D. We know how important that is, and have a great afternoon. We will see you tomorrow with another live stream. Take care, guys. Thanks so much for joining us on today's video. Hopefully you found it packed full of useful information. If you want to learn more about the premium Back in Shape membership, there's going to be a video somewhere underneath here. And if you want to stay up to date or tune in to some of our more recent live streams and the Q&As at the end of those, then that's going to be down here. And remember, you can subscribe to the channel up here and hit the notification bell to make sure you know when we next go live, so you can join us for our next live stream and Q&A.